Speaker, I want to spotlight and celebrate a team of academics and nurse clinicians led by Associate Professor Loretta Luck at the School of Nursing and Midwifery, Western Sydney University, and Nepean Blue Mountains Local Health District in their valuable work at Nepean Hospital. Speaker, violence against nurses is a widespread global problem. This violence typically includes physical and verbal aggression and abuse, workplace violence perpetrated by patients, their families and visitors. It is driven by multiple complex interrelated factors such as unmet patient expectations, high-stress, hectic healthcare environments, and social attitudes that fail to respect nurses' professional roles. And I refer RAS 2023 Gonzalez et al. 2025. These conditions increase the likelihood of aggression towards nurses, threatening the stability of healthcare systems, compromising patient care, and negatively impacting nurses' well-being. In Australia, the issue is particularly severe. Up to 95% of healthcare professionals report experiencing verbal or physical assault, and I reference the Australian College of Nursing 2021, WorkSafe Victoria 2020. Despite this prevalence, incidents are often underreported and the true prevalence is likely much higher. Registered nurses are at the highest risk, filing 1,848 serious workers' compensation claims for workforce violence between 2718 and 2122, the highest number among occupations with a high female share of employment, according to Safe Work Australia. The consequences of violence against nurses are profound. Nurses may experience increased stress, burnout and PTSD. The profession suffers as well, with violence contributing to attrition, exacerbating staff shortages and reducing job satisfaction. These challenges also result in substantial financial costs for healthcare systems and through staff turnover, compensation claims and decreased productivity. Strategies that help manage and mitigate violence towards nurses are needed across New South Wales. To address the challenge of violence, some mental health services have implemented the Safe Wards model, an interventional model designed for mental health contexts, which encourages nurses to reduce conflict and containment within mental health units, identify and address the causes of behaviours in staff and mental health patients that may result in harm, and support a culture of safety, respect and inclusion. The Safe Wards model has been shown to be an effective tool in reducing violence, enhancing safety for both nurses and patients, and fostering a more positive workplace environment. However, the model is specifically designed for mental health units and mental health patients. Recognising the value of Safe Wards model, a team of academics and nurse clinicians, as I said, led by Associate Professor Loretta Luck at the School of Nursing and Midwifery in Western Sydney University and at the Nepean Blue Mountains Health District, they introduced Safe Wards into general medical and surgical wards at Nepean Hospital, using action research where nurses actively participated in iteratively tailing the strategies they have successfully modified Safe Wards to meet the unique contextual needs of general nursing wards. The aim of the research was to implement Safe Wards and modify the resources for general ward nurses to help them mitigate and manage their workplace violence from patients and their visitors. Following thematic analysis of post-implementation focus groups, the researchers found nurses reporting using Safe Wards gave them the opportunity to briefly read through resources, gather their thoughts, take a breath, and successfully de-escalate situations. It engendered teamwork and they felt stronger together. The experienced nurses resoundingly discussed they supported new nursing staff with their acquisition of Safe Ward skills, in particular de-escalation skills. This collaborative approach has led to increased confidence in managing challenging situations and de-escalation situations, strengthened team cohesion and work environment, with particular benefits for new graduate nurses. This initiative represents one of the first New South Wales local health districts that have modified the Safe Wards initiatives for use in general medical surgical wards, and I congratulate this dedicated team.